Hello, my name is Rachel and I'm going to be your student nurse today. Can you please state your name and date of birth for me?
John Smith, 12/18/72.
Okay, Mr. Smith, I'm just going to look at your name band here. Okay, it looks like it matches. All right, Mr. Smith, what we're going to do today is we're just going to be changing your PICC line dressing here. Okay, do you have any questions before we begin? No. So during this procedure, part of it is sterile, so it's really important that you're going to be able to follow commands and that you're not going to break the sterile field. Do you have any concerns about that, or do you think you'll be able to follow that? Okay.
That'll be fine.
Okay, awesome. So then I'm going to wash my hands. Put on some gloves. I'm not doing that. Your hands are so small. Okay, I'm gonna wash my hands again. Just because why not, I guess. Okay, now I'm gonna prepare my sterile field. So I'm gonna open this package away from me. Okay, it's really important that during this procedure you wear a mask. Do you think you'll be able to do that today?
Yeah.
Okay. Do you have any allergies before we begin that I should know about? Ever been told you have an allergy to iodine or anything like that?
Nope.
Okay. And if my patient couldn't wear a mask, I would just instruct them to turn his or her head away from where we're going to be working. I'm going to take my mask here. Okay, so now what I'm going to do is I'm going to grab my tape measure here, and I'm just gonna, since you have a PICC line here, I'm just gonna measure up 6 inches from the insertion site, and I'm gonna take the circumference of your arm. If the number was different from your baseline by a half an inch, if it was different from your baseline from a half an inch, it would be important to note because that could be a sign of phlebitis or some other infection. It just is a sign of a problem. So we'd really want to be closely monitoring that. So I'm going to grab that there. And I'm going to compare it to your baseline, and everything looks good. So we're going to continue on. Okay. So now what I'm going to do is I'm just going to start removing your dressing. I'm going to anchor the PICC line here by keeping it in the middle, my finger in the middle. And I'm just going to pull away from the edges, working towards the insertion site. Not contaminating the insertion site. Okay. Now once the dressing is removed, I would look for drainage and measure it using COCA. So I would look for the color, odor, amount, consistency, and then I would document that. It looks like there's no drainage here, so if it was dripping, I would need to put it in my biohazard bag, but since there's no risk for contamination, there's no drainage, I can just throw it away in my normal garbage. So now that I've done that, I'm going to take off my gloves and put some gloves back on. Because I need to assess. And I'm just gonna look here. I'm going to just palpate around, feel for tenderness. I'm gonna look for redness, edema, ecchymosis, drainage, and approximation. When I touched your arm, Mr. Smith, did you feel any tenderness, or was it painful at all?
No.
Okay, perfect. So now I'm gonna remove my gloves, and I'm gonna wash my hands. And I'm gonna grab my sterile gloves here. And I'm just gonna use a part of the bed that he is not using. Mr. Smith, I'm just gonna be putting on my sterile gloves, and I'm gonna be using the end of your bed here. So it's important that while I do this, you don't bump it, because these are sterile, okay? Sound good?
Okay.
Okay, so what I'm going to do is I'm just going to put on Julie, I did it too. Okay, so now that my sterile gloves are on, I'm not going to break sterility. I'm going to take this, just throw it, not let my hands pass that. So then what I'm going to do is I'm going to grab my sterile cleansing thing here. I'm going to grab this, and I'm just going to take this, and I'm going to clean in a circle. I'll throw that away. Grab my next one. Clean, working from the inside to the outside. And then clean, working from inside to outside. And then I would take this and I would activate it. And then using a lot of friction, I would cleanse for 30 seconds or per agency policy. What's that noise?
It's just rubbing against the plastic.
No, that other screeching.
From it moving.
Okay. I'm gonna throw this away. Put this back. Then I'm going to grab my skin prep here. I would open it and I would go around the site. Be applying it. Now I'm going to remove my sterile gloves. I'm going to wash my hands. I'm going to grab my Tegaderm. I'll put my gloves on first, I guess. Grab my Tegaderm. Putting the pick in the center. I'm just going to apply my dressing. And I'm going to use this extra piece of tape here. Put this on this. And I'm going to put the date, the time, I'm going to initial it, and I'm going to use that here as an secure this tube again instead of using a piece of tape. So make sure that's really secure. Now I could put more tape or per agency policy, what I would need to do. Then I'm going to take off my gloves. I'm going to wash my hands. I'm going to remove the patient's mask. All right, so modifications across the lifespan. If this was a kiddo, we might need the parent in here to help. It can kind of be scary. Just explain it to them, maybe use a doll. Make sure my patient is comfortable, his call light is in reach, safety is provided. Do you need anything else before I go? And then I would document. So I would document all the drainage. I would document that I cleaned and that I changed the dressing and how he responded. Then I would clean up my supplies and then I would leave.